Welcome to Beyond the Smile, the podcast where we dive deep into dental health, nutrition, and everything that makes life more beautiful.
We always say diabetes affects your whole body, but have you ever thought about how it affects your mouth?
It's something a lot of people don't realize.
Right, and that's why we're doing this deep dive today, all about diabetes and oral health.
Absolutely, it's such an important topic.
It really is, and we've got this great guide here from Prime Dental Group.
They always have such good information.
Yeah, they really lay it all out, and today we're going to figure out just how connected these two things are.
Yeah, like what should people watch out for and what can they do to protect themselves?
Exactly, because get this, gum disease can actually make it harder to manage your blood sugar.
That's right. It's a two-way street.
So let's break it down.
Okay.
I mean, we all know the basics, right?
Mm-hmm.
High blood sugar means more sugar in your saliva, which creates a breeding ground for all that bacteria.
That's the starting point, yeah.
But how does that actually lead to gum disease?
Well, when we talk about gum disease, we're really talking about inflammation of the gums. It's also known as periodontal disease. And with diabetes, that extra sugar in your saliva, it fuels the growth of some harmful bacteria. One of the worst offenders is called Porphyromonas gingivalis.
Porphyromonas gingivalis.
Yeah, it's a mouthful.
It is.
But that little guy, it triggers inflammation in the gums.
So that's what kicks off the whole gum disease process.
Exactly. As that bacteria multiplies, it releases these toxins and those irritate the gums, and that leads to gingivitis.
Gingivitis. I think we've all seen those signs, like red swollen gums that bleed when you brush.
Yeah, you got it. And here's where it gets tricky for people with diabetes.
Okay.
That inflammation, it can be more intense and harder to control.
Oh, why is that?
Because diabetes can actually impair the body's natural defenses.
So it's like the bacteria, they have an advantage and our immune system is struggling to keep up.
Exactly. And if you don't take care of gingivitis, it can turn into periodontitis.
Periodontitis, that sounds serious.
It is, because that's when the infection spreads deeper and starts to affect the bone that supports your teeth. And as that inflammation becomes chronic, it sets off this chain reaction throughout your body, and that impacts your blood sugar control.
That's what the guide called the vicious cycle.
Exactly. It's a vicious cycle because when you have periodontitis, that chronic inflammation, it releases inflammatory chemicals into your bloodstream. Mm-hmm. And those chemicals, they interfere with how your body uses insulin.
Insulin, that's the hormone that regulates blood sugar, right?
Right. So gum disease can actually contribute to insulin resistance.
Oh, so it makes it harder for your body to process sugar.
Exactly. And that, of course, leads to higher blood sugar levels, which just feeds back into those oral health problems.
So that's this domino effect.
That's a good way to put it.
Inflammation leads to higher blood sugar, which leads to more inflammation and so on.
It's a cycle you really want to break.
Absolutely. So we've talked a lot about gum disease.
Yeah.
But the guide also mentions some other issues that are more common or more severe if you have diabetes.
Oh, right. Like tooth decay.
Yeah. Dry mouth, thrush, slow healing, all that.
All connected.
Yeah. So let's break those down, starting with tooth decay.
So remember all that extra sugar in the saliva?
Uh-huh.
Well, it's not just a feast for the bacteria that cause gum disease.
Oh, right.
It also feeds the bacteria that cause cavities.
Oh, no.
So people with diabetes, especially if their blood sugar isn't well controlled, they're at a higher risk.
Okay, what about dry mouth?
Yeah, xerostomia.
Xerostomia, that's a tough one.
Yeah, it can be.
I've experienced that. It's not fun.
Yeah, dry mouth, it's a common side effect of some medications.
Yeah.
But it can also be related to certain conditions like diabetes.
Right.
And saliva. It plays such an important role.
It does. It helps with chewing and swallowing, but it also washes away food particles.
Yeah. And it neutralizes acids that can damage your teeth.
Right. It's like your mouth's natural defense system.
Exactly. And when your mouth is dry, you lose that protection.
That's why we always say keep that water bottle handy.
Yes, hydration is key.
All right, so let's move on to oral infections, specifically thrush. What makes people with diabetes more susceptible to that?
So thrush is a fungal infection. It's caused by an overgrowth of Candida yeast.
Yeah,
and you guessed it, that yeast loves sugar. And remember, people with diabetes often have higher levels of sugar in their saliva.
Right.
So it's like giving those yeast cells an all-you-can-eat buffet.
They're having a party in there.
Exactly. And on top of that, diabetes can sometimes weaken the immune system, which makes it harder for your body to fight off any infection, including thrush.
That's a double whammy. Okay, last one, slow healing.
Yeah.
I'm guessing this is connected to blood sugar control as well.
High blood sugar levels can actually impair blood circulation.
Oh, wow.
And that slows down the body's ability to repair tissues.
Even a little cut or sore could take longer to heal.
Exactly. And that increases the risk of infection.
So it really highlights the importance of managing blood sugar.
Absolutely, for overall health and for oral health.
That's all.
And that's why a proactive approach is so important. Early detection and intervention are key.
That's a good place to leave it for now.
Yeah, we'll talk about what you can actually do to protect your oral health next time.
Sounds good. Stay tuned, everybody. We'll be right back after the break. So we know why diabetes and oral health are connected. But what can we actually do to protect ourselves?
That's the big question, right?
It is.
Yeah.
So this guide from Prime Dental Group has some good advice.
They always do.
Yeah. And the first tip is wear your retainer.
The retainer.
Seems pretty obvious if you've had braces.
Right.
But why is it especially important for people with diabetes?
Well, think about it. Even slight shifts in your teeth. Those can create spaces where bacteria can build up.
Oh, I see.
And for someone with diabetes, their gums are already more vulnerable to inflammation.
Right.
So any extra space becomes a breeding ground for bacteria.
So wearing your retainer is like shutting down those bacterial hideouts.
Exactly. Keep those teeth in line.
Okay, next tip. Maintain good oral hygiene.
The cornerstone of oral health.
I know, but sometimes it's easier said than done.
I hear you.
I'll admit, flossing isn't always at the top of my list.
Well, for someone with diabetes, it's really crucial.
Oh, really?
It is, because it's all about disrupting those bacterial communities.
Okay.
Think of it, every time you brush and floss, you're evicting those troublemaking bacteria.
Evicting the bacteria. I like that visual.
From their cozy little homes between your teeth and along your gum line.
We're the landlords of our mouths.
Exactly, and we got to keep those tenants in check.
Okay. Tip number 3, schedule regular dental visits.
Those are so important.
Yeah. I mean, we all know we should go for checkups and cleanings.
Right.
But is there anything specific for people with diabetes?
Well, for people with diabetes, those visits are about more than just cleanings and fillings.
Right.
It's an opportunity for early detection.
I see.
The dentist can spot the signs of gum disease or other issues that might be made worse by diabetes.
Before they become big problems.
Exactly. It's like having a second set of eyes watching out for your oral health.
Okay, good to know. Now let's talk about diet.
Always important.
The guide says watching what you eat is key for both diabetes and oral health.
Makes sense.
So any suggestions for snacks that satisfy both?
Absolutely. We want things that are low in sugar, don't stick to your teeth, and ideally stimulate saliva production.
Okay, so what would that be?
Well, crunchy veggies are a great choice.
Veggies?
Yeah, like carrots, celery sticks, bell peppers.
Oh, yeah.
They're low in sugar, and they actually help scrub your teeth as you chew.
They do double duty. I love that.
Another good option is cheese cubes.
Cheese?
Yeah. Low in sugar, high in calcium, which is great for strong teeth.
Okay.
Plain yogurt is also good as long as it's unsweetened.
Okay.
And a handful of almonds can be a nice, satisfying snack.
Great ideas. And of course, water.
Always water.
Helps rinse away all those sugars and acids.
Exactly.
Okay, last tip. Consider a mouth guard for sports.
Yes. Protection is key.
This seems especially important for athletes.
Definitely a mouth guard protects your teeth from impact during sports. And for people with diabetes who might have weaker teeth or slower healing times, it's a simple way to prevent dental trauma.
So whether you're playing basketball or skateboarding or just horsing around.
A mouth guard is a good idea.
Okay, so it all comes back to blood sugar control, right?
It really does.
The guide emphasizes that over and over.
And for good reason. When your blood sugar levels are in a healthy range, you're essentially starving those bacteria.
Starving them out.
They thrive on sugar. So by managing your diabetes, you're creating an environment that's less hospitable.
So managing your diabetes is good for your whole body.
Exactly. It's a win-win.
Now, the guide also talks about knowing when to seek immediate dental care.
Yes. When to call in the reinforcements.
Exactly. So what are some of those red flags?
Well, the guide says to watch out for severe tooth pain.
Pain that doesn't go away with over-the-counter stuff.
Right. That's definitely a sign that something's wrong.
Wait, what about swelling?
Any swelling in your mouth or face, especially if it's accompanied by pain or redness, that could indicate an infection.
So pain and swelling are big red flags.
They are.
What else?
Excessive bleeding from the gums.
Okay.
Now, some bleeding is normal, especially if you're just starting to floss more.
Right.
But if your gums bleed easily or excessively, that could be a sign of gum disease.
So if it looks or feels abnormal, get it checked out.
Exactly. And this is especially important for people with diabetes.
Because they're more at risk for complications.
Right. Slower healing times higher risk of infection.
So a minor issue for someone without diabetes could be a bigger problem for someone who does.
It's all about minimizing those risks.
And catching things early.
Exactly. It's all about minimizing those risks and catching things early.
So to sum it all up, oral health and diabetes, they're really intertwined.
Yeah, they really are.
Taking care of your mouth isn't just about a pretty smile.
Right. It's a crucial part of managing diabetes.
It's about understanding that what happens in your mouth can affect your whole body.
Especially your blood sugar.
This deep dive has been so eye-opening.
It really makes you think.
I know I'm going to be looking at my oral health in a whole new way now.
Me too. And I hope our listeners are too.
So now that you know about this connection, what's one small change you can make today to improve your oral health?
That's a good question.
I mean, is it finally committing to flossing every day? Or scheduling that dental checkup you've been putting off?
Could be.
Or maybe swapping out those sugary snacks for some healthier options.
All great ideas.
Whatever it is, we want to hear about it.
Share your commitment with us on social media.
Use the hashtag Deep Dive Dental Health.
We love hearing from you guys.
And remember, this deep dive is just for informational purposes.
Always consult with your own healthcare providers.
They can give you personalized guidance.
Until next time, keep those smiles healthy and bright